So we have been using Cercare for a few months now, and apart from the classical biomarkers, we have seen that we can produce OEF maps, for example, which seems to be very useful to predict the final infarction volume. The current issue that we had a few months back is that the diffusion can sometimes be reversible and not reflect the final infarction volume. And in our hospital, we like to treat large core infections. So it's important to be able to tell the neurologist whether there is a chance that some part of the diffusion area will regress. Another biomarker that is quite important, but remains to me a classical biomarker, is the core volume. The core volume has for a long time been the core volume has been done with thresholding of the ADC for a long time and for all the softwares on the market. And what we have noticed, because we produce both threshold-based volume and IA-based volume, is that the IA-based volume is usually more correct than the threshold-based volume. Especially with the threshold-based volume, we'll have a lot of false positives in the cerebellum and false negatives. And with the IA-based volume, we reduce drastically those false positives and false negatives. So it's not yet validated, but our impression is that these volumes are more reliable. Well, the evolutions of perfusion will continue, I guess. It's been already improved a lot since 10 years ago, especially with the arrival of those new biomarkers derived from the same perfusion series. So now I think we'll have to make progress in the acquisitions, raising the spatial resolution, the temporal resolution, and in that way I think the reliability of the biomarkers will be even more correct. And I think the new biomarker will come. Maybe we will demonstrate that the leakage biomarker might be useful in stroke as they are in tumor imaging. Maybe it will predict which patient will have hemorrhagic transformations. Maybe we can have some vessel size imaging capabilities by doing multiple echoes perfusion. So I believe the future will be very exciting. Oh, the Perfusion Summit is very well organized, and the lectures are very interesting. So it was really enlightening to be here and hear the speakers about tumors and stroke perfusion, and also be part of the future evolutions of the software. I find it very important that you get actual customer opinion about the new capabilities the software should have. And it's reassuring for the customers that you follow the advices and that you implement some of the advices that you got last year.